Well, Canada has often looked to places like the UK and Israel to get a sense of how effective vaccines have been against the virus. But experts say there's actually data here at home that can offer similar insight. Indigenous peoples were one of the priority groups in Phase 1 of Ontario's rollout, and data from the Canadian government has been keeping track of progress. CityNews reporter Faiza Amin joins us this morning to talk about what has been a successful rollout. Good morning to you, Faiza.
Good morning, Mel. And a number of factors here, of course, public health measures, but the key to the drop in cases and this vaccine rollout being successful, according to experts, is the vaccines, the COVID-19 vaccines. I'd like to share some numbers with you here. Now, back during the week of January 10th, there were about 4,800 active COVID-19 cases reported in First Nations communities. Now, fast forward to just last week, where that dropped to 739,000. And doctors and experts are saying that's due to the over 233,000 vaccines that have been administered in these communities. I spoke with Dr. Lisa Richardson. She's one of the healthcare professionals who traveled up north to these remote communities to administer the vaccine. She says what was key here is that Indigenous leaders and communities, along with organizations, played a key role in this rollout. Here's more from her.
What we need to learn from that for other groups is that the priority and the approach and the strategy to reach people and the physical settings where it happened and the providers who were giving the vaccine and the education around publicizing it and sharing information about it was all led by local Indigenous people. I think that is the key message here. Communities know what communities need.
And very well said right there, Faiza, because I was going to ask you, initially when the rollout was beginning, there was a question of hesitancy. We heard from various communities saying, I'm not quite sure about this. And so now it's the way in which it's communicated and who is telling them what they need to know or what they should consider, right?
Exactly. So the advocates and doctors like Dr. Lisa Richardson, they were well aware of this challenge. Given the history of racism and mistreatment in healthcare, not only experienced by Indigenous peoples, but also Black communities too. But you just showed a shot in Scarborough of a pop-up clinic, and there's a lineup out there already. And we've seen these long lineups at these pop-up clinics, just showing that people do want to get vaccinated and that there's not a lot of vaccine hesitancy that's been encountered. And many ways, actually, the demand does surpass the supply for that day. And I asked Dr. Richardson about this because we spoke about it months earlier too. And she said when she traveled to these communities, she didn't encounter vaccine hesitancy. She more so encountered gratitude. And she says we need to change the conversation around vaccine hesitancies. And tonight on CityNews at 5 and 6, we'll bring you more on this story. We'll also tell you why experts say this specific rollout helped Canada avoid a major catastrophe. And of course, as always, our story is already live on our website, citynews.ca. Mel.
Excellent. Great report. Faiza, thank you so much. Looking forward to tonight. Okay, 8:08 is what we're sitting at right now. We're checking in upstairs. Stephanie Henry, good morning.